So to start us off, to get the conversation going, I'd like to ask each of the panelists if you can talk a little bit about what sparked your interest in this area of agriculture, nutrition and health.
So why I'm interested in this field? So talking about the brief background context about it is, after studying public health and working in this field for a few years, what I realized that is it is well understood and well established. Public health is indistinguishably linked with many factors, including secure access to nutritious food, safe household environment, regular income, and health care. Additionally, various factors that are depends in different contexts and geographical areas. Based on that, I think if I have to do any project to improve population health, I think I need to do interdisciplinary research in this field. That's why I started to develop my project in this interdisciplinary field, bringing my supervisory team from environmental health, public health nutrition, biological science, and also from third sector. So next 1 hour, I'm really looking forward to share my learning and also get some learning from your experience.
I grew up in an agricultural community, spent most of my childhood in the Central Valley of California, so I think I had some exposure to agricultural issues from that. But I went into public health eventually for my graduate studies. And so, most of my interest in public health was on how social, economic, contextual factors impact health. And I had always had an interest in some of these issues, especially related to global health, development, economic development, globalization, and things like that. And so in my master's program, I was taking a course on the ecology of health and development, and for that had focused on my group project on food and agricultural production, and so had started getting becoming more interested in some of those topics, and tried to explore that a little bit further in a nutrition class and then a social policy course that I took. And so eventually, those experiences led to my current Emana Fellowship. So I'm doing an Emana Fellowship now, looking at agricultural policies, linking that to undernutrition in low and middle income countries. And so that's sort of how I got interested in this field.
I was actually trained as an ecologist, and I noticed when I did ecology, it was only related, there was no human interactions or elements of how humans affect the environment. So I ended up going to more international EPI, which does borrow a lot of its concepts from ecology. And then I ended up following through with a PhD that focused on the impact of environmental variability on nutrition. So it was very, in some ways, it was very cross-discipline. I'm putting in a plug for the next question. But it just seemed like a natural way to incorporate several different disciplines of interest. It seems like ecology people just tend to focus on like how something affects just like that. They don't really include the human element. And public health seemed like the natural sort of area that included all of these disciplines.
That's really interesting. So it sounds like we have like a diverse group of people. Santosh, why do you think the ability to work across disciplines is important? I mean, you alluded to this a little bit, but what struck your interest early on as something? Is it something that happened early in your career, even prior to embarking on the PhD, or is it something that while you were doing your PhD that you perhaps thought, there might be room here for working with researchers across disciplines?
Before starting my PhD, I was quite interested to know about the leading cause of disease and mortality in low and middle income countries, and especially around the children and young people. And what I found is undernutrition is one of the leading cause of child mortality in low and middle income countries. And while talking about undernutrition, is the causes of undernutrition is quite multifactorial, and it's kind of interlinked with, like a biological, environmental, and social factors. So it seems, if you look at undernutrition, it seems obvious that undernutrition is directly linked with food and nutrition insecurity. And it's directly linked with the amount of food produced up to the amount of food utilization. But if you look the causes of undernutrition in depth, there are so many distant factors that are linked with the causes of undernutrition, such as infection and like a communicable diseases. So that, after having the understanding of that broad picture, what I thought is, if we conduct multidisciplinary or interdisciplinary research, maybe at that point we can able to bring the greater impact on this field. And another benefit that I see by doing this interdisciplinary research is it can avoid unintended consequences. So, for example, if we are working in a discipline-specific project, for example, like if we want to improve the food security or nutrition security to improve nutrition, we can produce more food using inorganic fertilizer and pesticides. So if we are working in that field, then our main focus or outcome factor could be improving food productivity. And if we're working in a discipline-specific project, then we don't have capacity and resources to see the other unintended consequences, such as if you are going to produce food using inorganic fertilizer or pesticides, you're gonna be exposed to the chemicals, and that's gonna impact on your health. And going back to the the UNICEF framework for malnutrition 1990s, it says to improve nutrition, you need to improve the food security as well as healthcare and environmental health. So that was another, the factor that struck me to do this, interdisciplinary research in this field. And the third very interesting benefit of doing interdisciplinary research that I thought at that point is, the tipping effect that we call tipping effect. For example, if we are going to do the interdisciplinary research, maybe from one sector or discipline, we're gonna have a small benefit. But having the combined effect of all small benefit may gonna bring the positive, improvement in people's health. For example, if we're gonna improve nutrition, as well as if we're gonna improve the household environment, for example, in low and middle income country, especially in the rural area, most of the people, they use solid biomass to cook their food. So if we are not going to look in that factor, how people are going to prepare their food, then we're gonna miss that opportunity to address the impact of indoor air pollution on people's respiratory health. That's why I thought doing this interdisciplinary research gonna have a greater impact in the area of my research interest. So I started my...
I find that quite interesting also, just because having been trained as a nutritionist, I think was just deep in my nutritional science kind of space. But both you and I've brought up this quote by Aryo, who seems to also feel very similarly, where his understanding of the importance of this interdisciplinary work sort of started up from the get-go of his far before his PhD. And so I've just had this quote up here for him, from him, and it seems like there are, people who are not really quite so with their blinders on, as perhaps I was when I first started this journey. But talking a little bit about this word interdisciplinary research, oftentimes we use the words interdisciplinary and cross-disciplinary kind of interchangeably, but really it's not the same thing. And so interdisciplinary work is really, coming together of two or more disciplines to perhaps come together with some a newer integrated approach to the work that you're doing. Or while cross-disciplinary work is really just looking at this, similar issues, but just from a different angle, from your own discipline, and just, perhaps an economist describing something, and then a nutritionist describing it, and you exposing yourself to that work. So I'd like to, I think it sounds, across our panelists, Ramya, you have, it's quite a unique background of bringing together many different worlds. And so now with your current position, do you truly feel that you're working in an interdisciplinary team? And also not just about yourself, but whether you're working in an interdisciplinary team or using interdisciplinary approaches, but whether the people around you, because as researchers we really just don't work by ourselves. We have these teams that support us, and oftentimes we might call ourselves an interdisciplinary team of sorts. So I was just curious to hear from you your thoughts on that.
These sort of concepts are very related. So, for example, public health might have started as cross-disciplinary. Now you have something called international nutrition. You have a set of indicators, sort of like effective evidence, and now it's becoming its own interdisciplinary. So perhaps it's like an evolution of the process is what the terms define. So I was having this conversation early with my advisor, Laura Caulfield. She introduced the word transdisciplinary, just to add more mystery to this. It's the idea that you leave your field of expertise and you go to a new field, and then you look at it differently. And I think that's ideally where you want to be. And I do think there's a lot of value in being trained in one, like ecologists or economists, and then coming together, because you tend to understand the history very well. You tend to understand why people do what they do, why they choose linear probability models. We had this conversation yesterday. And the team that I work with, at least, my colleagues in Lupa is more ag statistician, and Isabel, like they're more international nutrition. And it actually is a reflective of how you're trained in your own school, whether you're trained by a land-grant school, whether you're trained by ag school, whether it's trained by, so it's a lot of that is your own training from the school that you get, and then also different speak. Like I've noticed that people say coefficient of variation or volatility, they're the same thing, or the coefficient or elasticity. It's almost having this sort of what word matches from my discipline to your discipline, but you might be actually just capturing the same thing. I do think I work in a very transdisciplinary team. But I will say, I just finished my PhD last fall, and when I was looking for jobs, and I wanted to include climate, ag, and nutrition. I could only pick either two of them. I could pick ag or nutrition, climate or nutrition, or climate or health, or it was very hard to find a project that sort of looked at these linkages in the climate, in a different climate variability perspective. So I'm happy to see, and I think we are right now with the ag, nutrition, and health, we're at the point where we're cross-disciplinary right now, but we might evolve to more interdisciplinary maybe years from now, where we'll have a set of indicators that's accepted and there's evidence for it. But I'm happy to see maybe a few years down the road, we'll start to have more interdisciplinary work.
I think there's evidence for both like interdisciplinary and cross-disciplinary work in agriculture, nutrition, and health. And I think they're not maybe necessarily that distinct. I think from my perspective, I feel like a lot of things maybe start out more cross-disciplinary, and then as a result of that, they sort of become interdisciplinary. So people might be looking at maybe a public health concept from more of an economics point of view, or looking at it the other way around. And then as a result of that, it's sort of new questions, new methods, new approaches develop, and it becomes more of an interdisciplinary thing. So I feel like it's kind of like maybe a process. So I think maybe the work I'm doing now, maybe I would see it a little bit more like cross-disciplinary right now at the point, but I feel like things might become a little bit more interdisciplinary with time.
Since most of you here, each of the panelists, I think, have finished your PhDs somewhat soon, and it's nice to think that, you know, we're done with our PhDs and we're sort of like experts with whatever the field that we're in. But, you know, as early career researchers, we're really trying to hone in our skills within the discipline in which we were trained, even well after graduation. And I'd like to ask all of you, while trying to, I think Ramya alluded to this, like, you know, the different ways people speak about things, but then also your training in certain methods and analytic methods. Do you feel that there might be some disadvantages, probably barriers to overcome, while you're trying to become an expert in your own discipline, but also then trying to speak across disciplines and communicate and sort of engage in this work? And, you know, do you feel like there might be a diluting of your own sort of disciplinary expertise?
I quite agree with what you are saying. You know, my background is, you know, I did my master's in environmental science, and at that time, you know, I was thinking working in environmental field is the greatest thing. And after that, I got an opportunity to work in a research field that was actually looking the effect of indoor air pollution on respiratory health. And after that, I realized if you want to improve the indoor air or household environment, then you are not just going to look on the impact factor that you are trying to improve the indoor air, but you are ultimately trying to improve the people's health. That's why health improvement is important. And after that, I went to do my, you know, master's in public health. And at that, after, you know, heavily work in public health, what I thought is you need to work in a public health in a very specialized way to tackle the health issues. But, you know, after working in this field, what I realized is we need to have a broader understanding. But sometimes going to do this, you know, broader understanding make us, you know, sometimes it can make us master of, jack of all, master of none, you know, something like that. Because in current, you know, global market, if you look at the vacancy bulletin, people are looking the expert or, you know, professional specialized in certain field. Even if you look at the, you know, the vacancy in interdisciplinary or multi-sectoral research, they are looking various people specialized in different, you know, area. And that makes us, you know, like an early career researcher feeling vulnerable, working in this, you know, interdisciplinary research during the early years. And another, you know, challenge of doing this interdisciplinary research is Ramya said before, you know, like finding the funding, right funding, and also, you know, it's quite challenging to find the supervisors, you know, from the, you know, various discipline, especially if you are working in low and middle income country where there is no such kind of interdisciplinary platform exists. And even in my case, you know, I found it very difficult to find the supervisors to have a, you know, like the interdisciplinary interest, because some of them quite interested to work with me, but they are still quite focused in their field. So that is another challenging that I found.
One thing that I noticed with interdisciplinary work is that sometimes it's not viewed as highly as, you know, work within specific disciplines, that there's not as much, you know, esteem. People maybe think of it as somewhat of a like fluffy type of, you know, work. So I think that's one challenge that sometimes you encounter doing interdisciplinary work. I think another one, as Santosh was mentioning, finding supervisors, finding the right fit. I think another thing I also would come across is sometimes also in like publishing, for example. So if you're doing work, you might be working on a topic that maybe a journal from a different field, it fits very well with a journal from a different field, but maybe you're coming from a discipline where maybe the methods that you're using might not necessarily be as common in that field, or the approach, or maybe the literature that you're looking at is different, and so that can create some challenges too, I think, in terms of trying to find the right types of journals to publish in. So I think there are a lot of challenges, just trying to navigate some of the differences in how and what types of methods different disciplines like to use. And I think the world is still very discipline specific. So it's so like doing interdisciplinary work, you have to kind of navigate all of those things. But I mean, I enjoy it, so.
I'm glad you brought up the issue of publications, and because I think that's something that comes across amongst and is commonly discussed amongst early career researchers about where they need to publish, and especially for their discipline, what's also considered to be an esteemed journal within their discipline versus publishing elsewhere. But Ramya, please do, try.
Oh yeah, definitely. There are a lot of challenges with that, finding good, like a committee of people who have different expertise. In terms of going back to whether it dilutes your experience, I don't know. I don't think so. One of the things I did when I started this project, which is looking at agriculture, introduction of chickens in Ethiopia, is that I didn't want to understand what the history of agriculture economics, and I asked Nilupa for a book recommendation, just to understand, because 8 times out of 10, they probably thought about all the things that you think about when you first come to the discipline. So it's kind of nice to see that rationale, like why do they go with this approach? Why do they go with this theory? Why do they choose this set of indicators? Why do they do this sort of design? So it's that, I think, is really nice. And if it also demystifies a lot of things. You have to find a good book that demystifies one discipline to another. So if you're interested in climate change or food prices or food variability, the book to do is Molly Brown's Food Security, Food Prices, Climate Variability book. So it really sort of explains what climate change is, mean and shift, mean and variability, just like really rationale, like why do people in this field chose this? And it walks you through, and I think that might be the key to being more cross-disciplinary. It's likely that everybody had sort of similar reasoning and logic, and so it's nice to see that thought process.
Not everybody might be in an academic setting. There's a lot of research going on related there's a lot of work going on that's programmatic, and then that there are researchers embedded in INGOs and things like that. So it would be worthwhile if you had any words of wisdom to share with our early career researchers in the crowd.
For anyone who would like to develop their future career in interdisciplinary research or want to do their PhD project in interdisciplinary research, the basic advice that I would like to give you is try to read well about the various journal articles, research work from various disciplines that you are trying to associate in your interdisciplinary research. That was the first advice given to me by my supervisor, because especially during the early career research phase, we might have some sort of understanding in one area, and we are quite interested to bring various factors or various disciplines together, but we need to have a broader research interest before we start our journey in interdisciplinary research. And sometimes as being overexcited or something like that, it's so easy to mix apple with orange, and say, I'm doing the interdisciplinary research. But you need to have a broader understanding why you are going to bring these different disciplines together. As I mentioned before, for my project, I was trying to combine 4 different domains agriculture, nutrition, indoor air quality, and water quality. And I started, actually I did my systematic review in the very early days of my, PhD. And my supervisor at that time, they said, Santosh, do the systematic review and see, maybe if there anyone already doing this research in this field, or whether you can bring this, different discipline together or not. And after doing that systematic review, especially in high-income country, my institution was based in Scotland, and at that time in 2013-14, there, when I went to the various symposium and a workshop, everyone was talking about interdisciplinary or multidisciplinary research. And at one point, I was thinking maybe I'm just going to duplicate someone's research. But after doing that systematic review, what I found is, especially in low and middle income countries, there is just less than 9% of this total research work is being conducted either in interdisciplinary or cross-disciplinary research. And that gave me the encouragement, like, okay, I'm going to do this something, and my research is going to provide the valuable contribution in this field. And I also published that research in BMC Public Health. And going back to the earlier discussion around the issue of publication, I also, as my research was focused in low and middle income country, and I was thinking to publish my research in Global South journals. But my research supervisors, they were quite interested me to publish in those journals, which has a high impact factors. But as and at that point, it was quite difficult to have a balance. But I was from low and middle income countries, and I would like to share this information to fellow researchers from low and middle income countries. Is we are lucky enough to get publication fee waived in various international peer review journals, which is the positive point. And we can, based on that, I was able to publish my research in open access journal, because I want to share my output to the fellow researcher in low and middle income country. And if I was not able to publish in that open access journal, then maybe it's going to be difficult for people whose institution is not have that sort of a subscription for the paid journals. The point is, try to read as many literature as possible. And the second advice I would like to give you all is to be openness to change and respect in the different views and opinion. Especially, some point, working in interdisciplinary research is being a servant of two different, masters. And maybe your research interest, based on your previous, background, may be inclined to one researcher or one discipline. But if you are going to, conduct the interdisciplinary research, you need to have a balance between the various disciplines. That's why I would suggest you all to be openness to change. And the final advice I would like to give you is try to speak in simple language. As we mentioned earlier, it's so difficult to talk about the jargon from your specialized area. And especially while you are working in interdisciplinary field, you need to have a habit or way of disseminating your information in a simple language. And trust me, speaking in simple language is not simple as we think.
I mean, I'm still very early in my career, so I probably haven't built up a whole lot of experience, but from what I've seen, and then also from some advice I've received from some of my mentors and supervisors, I think what I would like to say is just to encourage people working in interdisciplinary work to bring your training, and say if you were trained in a specific discipline or field and you're working on something in maybe a different discipline or field, I think there's value in bringing your background, your experience, and your training into that field and approaching it from that lens. I think a lot of times innovation happens that way. I was lucky to have my dissertation advisor. He was very much into interdisciplinary work. He didn't really fear the whole jack of all trades and master of none thing. And he tried to encourage people to learn about different fields and also sort of bring concepts from other fields into the work they're doing. And he had a term he brought from economics that he liked to call arbitrage, where he would talk about like maybe there's a concept that's very popular or very common in one field and it might not be something completely new to another field, maybe something from economics that isn't really known in public health. Sometimes you can bring those concepts into the field and sort of even create new avenues for research, create a lot of innovation and new ways of looking at something, and even build your whole career around some of those, I guess, cross-disciplinary types of activities. So I think there's a lot of value, even if you're maybe not yourself maybe an interdisciplinary field. I think there's a lot of value in, I guess, cross-pollination, bringing ideas from different fields together or applying them to a new field. So I think I would just like to encourage people to do that. And for now, I think that's some of the advice that I can give to others.
A lot of the times I try to describe something, it turns out it's like conspicuous consumption or it's moral economy. That's what I'm trying to explain. And it's really great because the economists really, they know their labels, and it's really nice to evoke that sort of label into a different setting. I think for me, at least, that I'm facing right now, the global North-South challenge to me is this term of safari scientist, which was introduced to me. It's a super cute way of saying you parachute in, you do whatever you want, and you go back, you publish, that's it. And you honestly, you could do that even when you're in Baltimore and you're sitting in a Baltimore population. And I'm trying to figure out how to. It's hard, at least as an early career scientist. It's like, how do I make these linkages? How do I be invited to introduce some of these results to the Ministry of Public Health, or whatever it's so. And I think this might be a question to the older established career professionals, is how have you done it? I've seen one really nice model, Jean Humphrey in Zimbabwe, where she's done both research and action. So it's called research action approach. And that's great if you're doing like that sort of that sort of field. But I would really be curious to know how you've sort of overcome the safari scientist, and it's also great because you want to be involved in the local. You want to stay. Either you live here, or you don't have to live there. But I want to understand how that you overcome. And the other thing I would encourage, and then this is something I do this also, is just do cold emails. Like 8 times out of 10, you'll never get a reply, but the 2 times out of 10, you will. So it's just
explain what cold emails are.
Thank you. So if you see a paper or if you see somebody and you want to go introduce yourself and you see some concept, just email them and introduce yourself and tell them what you're doing. And it'll be nice if they could share their tool and we could share your experiences. That's the cold email. You don't have a link. But although we have 6 degrees of separation, so you might have a link. So just don't be afraid to do that. As at least as a first year or second year PhD student, I definitely felt like, oh, I'm just some PhD student who no one would care about this. But I've somehow overcome it and do a lot of cold emails now.
You know, I like that Ramya brought up this perhaps ask of our, let's not say old, right? So experienced colleagues in the room who have been doing this work for a while. And, you know, I think it would be nice also in this space that we have in the next 5 days. A lot of the time we have these early career research discussions, and it's people might hear it, and I think we're all giving advice to each other. And I think it might be an opportunity for us as early career researchers also to, because I've heard all of these things before, and I think it's something that we really feel, and it's probably something that you feel further along in your career as well, but it's just trying to make it happen, and perhaps that we can also be part of the demand to make some of these things happen, to make it such that our disciplines are understood and the language is kept simple, and that we sort of demand that across the board from our colleagues. And similarly with being committed to the science and being based in our communities that we collect data from. And so yeah, that's a call over the next 5 days for all of us also to challenge our colleagues in the room who've been doing this for a long time to engage in a discussion as to how to keep this going. But with that, I'd like to open up the floor to questions.
How logical do you think that we have been working in the interdisciplinary work for this well-being and good health through the nutrition? Do you think that we have addressed the issues that is burning in the developing or transitional countries like Nepal? Have we addressed the issue of family planning so far? And do you think we need to incorporate this issue into the multidisciplinary or interdisciplinary research work in nutrition?
But I would like to advise the colleagues in the panel and others that it's all about people. If you link yourself into the people, who are going to benefit from your research, it's not actually that difficult to be multidisciplinary in your thinking, although you can act through your specialized area. So the way you think and analyze the issue is very much multidisciplinary, but you obviously you have confidence in the area where you are competent, but you know that there are all these other areas that come to impinge on your work. And you then introduce the whole idea that you are not a safari, researcher. You actually have to spend time with those that you think your research is going to help. If it's the researchers you are trying to help and they're trying to develop methods for fellow researchers, then of course you spend more time with those. But if you're interested at the sort of grassroots community level, there's nothing that beats being in that community, thinking like them, being empathetic and seeing what they do. When you come out of there, you are the most multidisciplinary or interdisciplinary person that you'd ever find. We can talk and theorize, but unless you get down there, it's not going to work. You really have to be there. At some point in your life, do it early for the young guys. Please go early. And I came from a village, but later on in my career, I didn't recognize the village I came from because I'd lost it. So you need to go back and reconnect.
Just to briefly address the question about the family planning and nutrition, I don't have expertise in this area, but from what you're saying, it does sound like a fruitful, avenue to go down, and it sounds like it makes sense. And perhaps there isn't a whole lot of work so far bringing together family planning and nutrition, but that might be where you could potentially be a pioneer in that field and trying to bring them together and look at them that way. So it does, to me, it sounds like it makes sense. And then also to Dr. Simpa's comments, I think those were also very useful comments, and I find myself thinking about that as well, especially in academia. A lot of times you feel like you become disconnected from what's going on the ground. You're working at a very theoretical, almost like ivory tower type of setting. So a lot of times it's easy to feel disconnected. And I think if you can, and other people here can share ways that they've managed that, I think that would be great. I feel like maybe one solution to this whole safari research that you were talking about, I think the Emana program, for example, is helping to do that a little bit by sort of encouraging these global north, global south types of collaboration. So, a lot of times I feel like, especially when you have an opportunity or maybe you get your training, say, in the global north, a lot of times there's, I think, a lot of skepticism about choosing to maybe go to the global south to work or maybe to build your career there, and people might feel like, well, why are you doing that? There aren't that many resources, and it's going to kill your career and research and things like that. But I do feel that there's a lot of value in doing that, because otherwise it does become almost like this safari research thing where you're maybe stuck in an institution doing research about some other place and not really having that many opportunities to do that. So I do appreciate, programs like Emana and things that encourage that type of collaboration and, allow for opportunities to actually do research, on the ground, be parts of the communities that you're studying and not necessarily just
until I do my master's in public health. What I was thinking at that point is, the people from public health can solve the health-related issues. But, after having the broader understanding of the, out-of-box thinking, when I started looking to this issue from, just going outside my discipline, I think there are so many other factors that we need to link to improve in our, the primary outcome that we are particularly interested to do research on. For example, taking example of undernutrition, as I said before, we can improve the child nutrition giving the, like a home gardening or that sort of, like a dietary intervention. But, like many children who are suffering the undernutrition, they are also suffering from other, like deprivation, such as, they are living in poorer household condition, they have no access to clean drinking water. Because of that, they are vulnerable to the infectious diseases. So if we are not going to look in that broader picture to improve the, the environmental health, we couldn't able to get the, success in terms of reducing child undernutrition. And this is not, I'm saying, this is not interdisciplinary research saying, this is the learning that we got from, the Millennium Development Goal, the unfinished, the agendas from Millennium Development Goal. And, I would like to give another example of the semi-structured randomized controlled trial that been conducted in Malawi by environmental experts. They were actually trying to look the improvement in childhood pneumonia symptoms in Malawi, just giving the household indoor air quality intervention. Because they thought the improved cookie stove that can able to reduce significant amount of indoor air pollution, which was one of the burning issue in most of the low and middle income countries. And they thought if we're gonna improve in indoor air quality, giving that improved cookie stove, then we can able to bring the positive change in terms of pneumonia incidence in children. But at the end of the research, it was double-blinded, randomized controlled trial, and at the end, researchers, they were just surprised because they couldn't able to bring the positive improvement in childhood pneumonia, but they were able to improve significant improvement in household air quality. And after that, they were trying to see what's going wrong. We all know, and there is plenty of evidence, improving household environment can improve in childhood pneumonia, but in this case, they were not able to get the improvement in childhood pneumonia. And after that, what they realize is maybe there are some other distant factor. They are underpinning on these, childhood pneumonia. And if you look at this, the other evidence from, malnutrition, nutrition-specific project, what you can see is 95% of, the symptoms of undernutrition are linked with childhood pneumonia, and which is leading cause of child death. So, without improving, if you are working in environmental field, at that time, you don't think improving, undernutrition, working with nutrition or agricultural expert to improve childhood nutrition, you don't think that's gonna bring the positive change in terms of childhood pneumonia because you are just focused to improve childhood pneumonia, giving the, improved cookie stove. That's why we need to think going beyond the, beyond the discipline, and we need to work in interdisciplinary field. And I would also like to highlight one example of Nepal. like 2 years ago, I came to Nepal to run one, multi-sectoral, like a stakeholder workshop in Kathmandu. And at that time, what I came to know is, there is a Suara project, which is good nutrition project, is going quite successful in many parts of the Nepal. But in that project, as they are trying to improve the nutrition, they are giving home gardening as well as wash, a component. But as they are missing to give the, household environmental intervention such as, the improved cooking stove. That's why, especially while cooking the meal, most of the women, especially in low and middle income country, most of the women, they are engaged with the cooking activities. And while cooking, they have a child care issue. They're gonna carry their child while cooking, and because of that, both mom and children, they are exposed to indoor air, pollution from the very early days. And because of that, they have a poor respiratory health. And if you are not going to address that issue, you are not able to success in terms of improving either childhood nutrition or pneumonia.
If you look at global nutrition, they really care about the child, the birth weight, the growth, the EE, the IYCF. It's geared towards the child's health. And there's really women's health, not even maternal health, but women's health really needs to make that. Like, I think this is something that I would like to see for ag nutrition and health, as we are understanding how important the gender dimension is, even in terms of climate, is to really look at like what women's health as like an absolute term, not because it relates to the child. And I think it would be really nice to see, more linkages from family planning, and it doesn't have to be related to child health. And it would be great because you're still improving a person who happens to be a woman, her health. And I hope we make it more equitable by establishing that ag nutrition health has a huge women's dietary diversity, or women's nutrition or women's health component in it. And then quickly adding to Simba's comment, I agree. I think you can either do community sort of collaboration or capacity building collaboration. And I come to the term because I was here last week in the same hotel doing a dietary workshop for our Mallet cohort, is that how important that research capacity building is. It's literally handing down data, going through it, and how to look at the data. So it makes me happy. If I can't be in a country, this is the best thing I can do, and it makes me happy to do that sort of, that's still a really great way to be not do safari scientists.
I think in response to your question about family planning and nutrition, I think there are some efforts, I think even here in Nepal, to attempt to, yeah, exactly, some efforts to include family planning interventions in multi-sectoral programs that are ongoing. And I think something also that, might add to this is just research about the area. So there's been a lot of push globally, and unfortunately it's always related to the child, right? But there has been a push globally to address the adolescent girl in more ways than one. Again, in the hopes that we are promoting better birth outcomes. But definitely one of those things is preventing early marriage and family planning that goes along with that. But you are definitely right that there's a gap there, and thanks for bringing up that point. I'd like to take a few more questions from the audience.
Are there aspects of your training, whether they were curriculum or research experiences or training, other kinds of training, where you felt a gap that would have been useful now as you're going into these interdisciplinary research areas?
This panel is really relevant for people like me who have a background in the developing countries, have been trained in a different setting, and have this really a strong interest to go back and collaborate and see how this works. Are there any key asks that you would have as young researchers, maybe to the global public or other institutions? I know the IMANA program is doing a great job of bringing back resources back into developing country settings. But do you have any key asks? I can think of a couple of key asks that I think that would be useful to support this going back and maybe encouraging further research in the areas where definitely there's a clear lack of expertise, but doing interdisciplinary work is really, really a new concept that is not primarily supported by a lot of institutions in developing countries.
In interdisciplinary research, even in Scotland, we are facing the problem of not accepting the another expert or the people from another disciplines, and although I have not that much experience of working based in Nepal, but from my previous workshop that I hold back in 2015, what I found is the problem is created because most of the interdisciplinary or multi-sectoral project, for example, taking example of multi-sectoral nutrition plan in Nepal, like this sort of project, most of the project that has been designed by health sector or from one sector, and they're gonna design the project, and after that, when they realize they need the expert from other discipline, and at that time, they're gonna invite or include people from the different discipline, and that creates the problem. If you were working with those health professionals during the intervention design or project design phase, then they wouldn't be asking why you are here, why agriculture people are here, because they already understand your input. So I think to solve these, the issues, I think we need to work together from the very beginning, especially during the, project development phase, while we are setting the research objectives, research questions, we need to work in interdisciplinary so that we all know the, the inputs that people from different disciplines gonna bring. Otherwise, we couldn't able to, see each other's existence, and especially in this global market, everyone wants to secure their job. And if I'm not aware, about your input in my project, but if I see someone totally, outside from my project is interested or coming to work in my project, at that time, I fear about my job security as well. And because of that, people gonna ask this sort of questions, why you are here? And the language that we are used, and even while you sharing your experience, what you said is that person was working for you. We are not supposed to use this language, I'm working for someone or someone is working for me. We need to speak the language we are working with. We're working together, not for someone. So when we're gonna have this sort of understanding, when we're gonna have this sort of relationship, and when we're gonna accept each other's existence, at that time, I think there is no any issues.
I think, at least to me, the impression I get is that things are moving more towards interdisciplinary work. I feel like a lot of students are going into school with interest in not just one field, but multiple disciplines, or people might be coming from one background and moving into another. So I think, at least I hope that with time, it won't be as outlandish to maybe be coming from agriculture, and at least it won't be seen as that, right? Because I think people are starting to understand the links more between different fields, and that maybe just looking at something from one lens only doesn't necessarily help to solve problems that well. So at least I hope things will improve that way. In terms of your question about what would be my big ask in terms of helping to improve research, and especially for the Global South, I think for me it would be around maybe data access and also research capacity. I think improving access to data would definitely help with a lot of work. And then also improving research capacity. I feel like a lot of times now, the way the system works is that the Global South ends up being the producer of raw materials. So they produce the data, and then, it kind of goes to, and then it gets analyzed by maybe researchers in the Global North, and there isn't as much I guess maybe there isn't as much research capacity to analyze data in the global south, or there isn't as much access for people in the global south to access data that maybe might be produced by people in the global north. And I think that causes a lot of barriers or limits and hinders opportunities for work. So I think I would like to see some changes in that type of system, more data access, more research capacity, less of this kind of like data mining, pulling it out, and and more of this collaborative type of work.
So I think it's a great idea about the kiosks and how like having interdisciplinary, and I think this is something maybe the Global Consortium of Agriculture could do, just identify organizations. Maybe they could do a quick module, a quick workshop with them, and then say have this like label or registration that we understand interdisciplinary science, our organization understands it. So that could be a very simple way to identify local organization, NGOs, or whatever it is, research capacity building to do that. And that's very simple, just cost effective and efficient. And then that could also address this issue of like, hey, the science person, or the health person, or the trop docs, just trying to let them know why agriculture is important to health. So that gets it. And then the gaps with the training, I'm actually curious to what people would say about this. I've noticed my biggest gap when I came to the Harvard group is I did not know how to budget. It was like, besides just the Excel sheet and adding whatever, it's like, yearly, just thinking through that process. I think, I know it sounds really simple and won't take more than a couple of days to really understand what a good budget looks like. I think I really got a crash course at this while I was there, and I'm really appreciative of that. And I think that's important with just funding coming from different organizations, going back and forth, north and south, south and north. So that's I think is really key to understanding that.
I will close the session for today, and thank you all for your attendance.